Welcome to Health Expert channel. I am Dr. Sai Laxman. I am an orthopedic surgeon at KIMS Hospital, Kondapur. Today we are going to talk about surgery of spine. The terminology like surgery and spine, they cause a lot of conflict in everybody's mind. So I wanted to talk about certain misconceptions in the surgery of spine. There are straightforward cases wherein we see a disc prolapse in young people, either because of continuous sitting or loss of activity, or because of accidental lifting of weights, or a minor trauma. In these cases, when the disc degenerates and it prolapses, goes back and presses one of the nerves, it can be, usually we try to fix it with either by rest, medication, if not injections, and physical therapy. Majority of the times these treatments should be enough, but in a rare case where there is a huge disc and compression, we advise the people to undergo either a endoscopic microdiscectomy or a microdiscectomy, or a little more bigger procedure like a fixation, wherein more than one level of discs are involved. Now, having said that, this is a very successful surgery and the rate of complications are very, very less. But having said this, if you look at the other category of patients who come for spinal surgery, example, take a patient of mine who had a huge traffic accident on the highway, and when they were presenting to the hospital, by the time they had come, they had a complete transection of the cord. So we had tried our best to repair the cord, but the chances of recovery or not recovery depends on the initial damage. Now, looking at these complications where a patient who had a huge trauma did not recover gets a bad name to the procedure itself. For a routine procedure, if these patients have to go online and do a research and they come across a patient who has not recovered, so that puts them in a dilemma. So this dilemma is by comparing a different kind of patient. So about 50% of the patients who come to us, they do not have any complications. They are like, they walk in with an MRI or come to us for advice, we get an MRI and get them operated. But some of them who come to especially those who present to the emergency with huge trauma, the chances of recovery are based on the initial injury itself. If they come with a transient injury, they recover well. If they come with a complete injury, in spite of the best of our efforts, they may not recover. So a patient coming to the emergency with a huge trauma may have a successful surgery but may not have a whole lot of recovery. Do not compare yourself to that person. Those people who are taking one or two opinions and coming to the OPD on a regular basis and have tried all the other formalities that we have discussed, the procedures like physiotherapy or medication and rest. In spite of that, they do not get relief, they are advised surgery. So now a elective spinal surgery is always safe, does not carry any complications. The smaller complications like an infection or a tingling of the nerve, numbness for a few days will usually recover. Please do not compare yourself to a person who has presented to the emergency with a fall from height or a huge road traffic accident, because that category of spine is a totally different treatment altogether. So if you have any doubts regarding, you can always consult it directly or go to a doctor whom you believe in and make sure that you ask all your queries. But don't be under the apprehension that because a spinal patient, especially a huge trauma patient with a complete transection of the spinal cord, has not recovered, all the spinal problems, surgeries are complicated and they have problems. So if I am able to send out this message that not all surgeries of spinal, especially the elective ones, are not complicated, they are safe, they can be done regularly and they give a good relief, only, especially, I am not saying a surgery is the must for everybody, only in cases where it is indicated, you have to undergo rather having these doubts. Thank you.